Thank you so much for joining us on the first edition of Health News in the year 2015. I'm glad we made it into the new year. I'm Yomi Otaigbe. On our last edition of the program, we brought to you some of the events that defined activities in Nigeria's health sector last year. Now, how was the year 2014 for you in terms of what the health sector offered? I'll bring you the assessment of some Nigerians and that of a former president of the Nigerian Medical Association, Dr. Osahon Enabulele, in the course of the program. For those of you who may have missed out on last week's edition of the program, my colleague Mary Alale Yusuf also put together a report that highlights activities in the health sector in 2014. Take a look.
The year 2014 started out with undercurrents of dissatisfaction in the health sector, carried over from the previous year. Health workers, under the aegis of Joint Health Workers Union, were the first to go on a 3-day warning strike, protesting what they called discrimination by the federal government. Resident doctors nationwide followed suit on June the 1st, demanding payment of outstanding salaries and functionality of the residency training program, among other things. These became full-fledged industrial action on July the 1st for all doctors in public service and November 12th for the health workers, leaving in their wake some very dissatisfied patients.
You will just come and let us know that we should just go, that doctors are on strike. So we are just here.
They gave us notice that they have discharged us, that they cannot do the work alone. That without the nurses, they cannot do the work alone. And since then, no care, nothing.
In mid-August, the government suspended the residency training program, relieving about 16,000 resident doctors of their jobs.
Great Nigerian doctors!
They said this was for appraisal of the challenges in the sector. 2 weeks later, the strike was called off and the program reinstated. In late July, the ravaging Ebola virus disease, which had taken hold in the 3 West African countries of Guinea, Liberia, and Sierra Leone, was imported into Nigeria by now well-known Patrick Sawyer when he traveled into Lagos sick. At the time, doctors in public hospitals were on strike, and the problem landed on the lap of a private hospital, First Consultants. That outbreak cost the nation 7 Nigerian lives, 4 of which came from First Consultants Hospital. Among them, the late Dr. Ameyo Adadevo, who courageously resisted pressure to release the contagious index case. 12 others were rescued from death's door.
It's a tribute to the professionalism of Nigerians, the patriotism, and our ability to collaborate with other agencies. That's what did it.
On the 20th of October, the World Health Organization declared Nigeria Ebola-free.
WHO officially declares that Nigeria is now free of Ebola virus transmission.
Also in October, the Minister of Health, Professor Onyebuchi Chukwu, resigned to run for governor in Ebonyi State. Dr. Kaliru Al-Hassan took over as supervising Minister of Health. The year also witnessed a decline in the numbers of wild polio virus cases in the country to 6, down from 50 in 2013. Another high point in the health sector was the signing of the National Health Bill into law by President Goodluck Jonathan in late November.
One of the major things you will see in this particular Health Act is that government, through law, through legislation, is going to place a lot of premium on primary health care because it's dedicated, fixated amount of money will come from the consolidated fund, 1% I think, which will be channeled to the National Primary Healthcare Development Agency to fund the totality of endeavors that revolves around primary health care. In other words, government is saying preventive health care will become the approach. There would also be some funds specially dedicated towards the procurement of essential drugs. Today, under the National Health Act, The National Council on Health has gone beyond a mere advisory body. It has become the highest policy-making body in the health sector in Nigeria by law.
Even though 2014 did not see the end to rivalries and complaints in the health sector, there were a few laudable events, one of which was the dispatch of 250 trained Nigerian volunteers in early December to help the effort against the Ebola virus disease in affected West African nations.
For some Nigerians, activities and services in the country's health sector during the past year leaves much to be desired. What are the people looking for to see better this new year in the sector? Here are a few of their opinions.
I would rather tell our government, or incoming or the old one, that there's need for them to give priority to the health sector. Why? Because it's like the bedrock of the nation. If the country is sick, or if individual citizens are sick, or if we can't get adequate services, then the country itself as a whole is sick.
The health sector is terrible, seriously in a comatose situation. Everything is down now. JR Suit, or what they call, is on strike. I have a friend that is a medical doctor. They are doing skeletal work in Abuja, in Nasarawa. What's the capital of that Nasarawa state? That's where he's working. And he says it's just skeletal work they are doing. Everything is down. I pray the government will do something quick to revive the health sector, because in fact, the hospital is like a mortuary now, and the government need to work hard to inject money to the health sector. Treat the doctors well, treat the nurses well. The health workers should be treated well. They should be taken care of so that they can take care of other people.
Health sector in Nigeria, I thank God that my son went for operation, and the operation he went for is very, very successfully at General Hospital, really Agege. I want government to improve in the sector of health in our general hospitals, because by going to abroad to go and do operation, I think our doctors are capable to do it. What I've asked them that they should give them equipment to be able to carry the ability to be able to do the work successfully, instead of wasting our money to abroad.
If you look at it, we have various illness and diseases that are coming up, and thank God we give kudos to what the government of Lagos State did during the Ebola outbreak, and we thank God. So in 2015, the government should concentrate more in providing the facility and make sure that they equip the health workers such that they will not even intend to go on strike.
They and the government should settle down amicably and put their disputes aside, and then let the people in Nigeria to enjoy the health facilities. Because after all, I'm a worker. They subtract my tax every day, every month, and then the tax was using for the caring of the people who are not up to the standard, like welfare of the people in Nigeria. So it's better for the government to utilize the taxes that is taken from all the workers in order to do necessary things for the welfare of Nigerian people.
Coming up after the break, former NMA President Dr. Osahon Enabulele shares his thoughts on moving Nigeria's health sector forward in 2015.